Parents and teachers are demanding New York City provide a safe and equitable plan to reopen schools. A group of demonstrators marched through Lower Manhattan yesterday protesting the city's current proposal. Mayor Bill de Blasio pushed back most in-person schooling another week. Teachers say they're concerned about poor ventilation and a staffing crunch. Parents want more clarity as to when kids can go back. New York State has largely controlled its coronavirus outbreak since those disastrous first few months. More than 33,000 New Yorkers have died since February, and there have been at least 447,000 cases. But the state's infection rate has been at or below 1% for about 40 days. Mayor de Blasio's top health advisor says the city is taking steps to increase its testing capabilities by opening its own lab. The city plans to process about 20,000 daily tests by November, producing results within 48 hours. Even as the curve drops in New York, the pandemic remains a persistent threat nationwide. COVID-19 has killed more than 197,000 Americans. At least 6.6 million people have been infected in the U.S. For more on New York's response to the coronavirus, I want to bring in Kathy Hochul in Buffalo. She is the state's Lieutenant Governor. Lieutenant Governor, welcome. Thank you for being with us.
Thanks for having me on the show today.
So, is Mayor de Blasio making the right decision in delaying in-person classes in New York City again for most students?
Well, I know how exasperating this is for parents who need to work on childcare and will they be getting back to their jobs, and it's very disruptive to not have that clarity. The governor and I wanted to make sure that we empowered our local school districts to make the decisions based on not just what they want, but in consultation with teachers and parents as well. So it is our hope that they can figure this out and make sure that parents know what's coming and not give them last-minute notification, which is, how do you deal with that? How do you figure out who's going to watch your own children if you thought they were going to be in schools, for example? So we hope they can figure this out because there's literally thousands of families that are affected by this.
And of course, we just mentioned those protests from teachers in the city against reopening. Are schools adequately prepared to protect both students and teachers? And then what is the state doing to help families, as you mentioned, that need help with childcare just so they can get back to work?
Well, we've asked the schools since July to follow very stringent state protocols, 144 pages of what we want to see in a school before they can reopen. And it deals with the social distancing and the ventilation and how they're going to handle a case if they become aware that a child is symptomatic and tests positive. That's why we have something known as a statewide school dashboard where parents can literally look up their school district and find out what's happening with how many kids have been tested, what the infection rate is. So we want to empower parents with that knowledge. But you mentioned childcare. I have been going around the state years before this, sounding the alarm that we have a childcare shortage. It's too expensive and it's too scarce. And now you amplify that with parents who can't rely on the schools to be a place their children are safe for the majority of the day. It's disastrous. So the state of New York has a funding program. We just allocated $88 million in funding for child care providers and for essential workers to make sure someone's watching their children so they can literally stay in the hospital, save lives, or make sure that we have our food on our tables and the grocery stores function. We've really broadened the idea of who an essential worker is, and they need our help now more than ever because who's watching their children when they're out there during the middle of a pandemic, leaving in the safety of their homes to help all of us get through our days.
And Lieutenant Governor, we know how badly the coronavirus hit New York in those early days of the pandemic. But now the state's infection rate has been at or below 1% for more than 40 days. It's something I think a lot of New Yorkers take pride in. Governor Andrew Cuomo is rolling back restrictions, including allowing indoor dining to resume in the city on September 30th with 25% capacity. The infection rate is low, obviously, but why is the state confident it can allow more aggressive reopening right now, especially with other areas of the country still, having outbreaks? And what benchmarks would cause the state to reverse course?
Well, you put a lot on the plate, but let me peel it off. First of all, yes, we do have among the lowest infection rates in the nation 41 days where the infection rate has been below 1%. That's extraordinary. We don't get the credit for that. New Yorkers get the credit for following very firm guidelines that we laid out early on. We've been transparent, telling people that if you wear a mask, something as simple as wearing a mask, we can shut this pandemic and this virus down. And New Yorkers listen, they're adhering to social distancing, but something like restaurants, we're now at a point we feel that if people keep doing what we've asked them to do, the restaurants cooperate with us, and if there's an enforcement mechanism, we can make sure that we can allow people to dine indoors safely. We want to get our economy back going. We're not going to do it a second sooner than it's safe, but if you follow what we've been doing since the very beginning, it just breaks my heart to know that the rest of the country, the entire United States, could have had the same infection rate as us, 1% or less, and we'd be able to start getting back to some sense of normal. But because Donald Trump politicized this, he made it all about, freedoms and liberties and all sorts of crazy things that have nothing to do with surviving a pandemic. We're far worse off than many other countries. As far as the benchmark you asked about, we feel comfortable 1% or a little bit less. We get anxious if the numbers start approaching 2 or 3% for sure. And that's we're watching very closely. But we have been guided by science and data from the very beginning, no politics involved. And that's why New York is in such a good place right now.
Okay, well, I want to sort of dive in, though, to the issue about the restaurants a little bit more carefully, because a CDC study found that COVID-19 positive people were twice as likely to have recently reported dining at a restaurant, the only activity that obviously makes mask wearing difficult. Like I said earlier, New Yorkers are proud that we have such a low infection rate. Everyone is enjoying seeing restaurants, have a bit of a comeback with the outdoor dining. But people get a little nervous about the indoor dining. And as Eater New York's chief food critic, Ryan Sutton, recently pointed out, New York State is not requiring restaurant goers to wear masks at the table before and after their food arrives. So that exposure can technically put low-wage workers in restaurants at risk. How will the state then balance protecting the financial health of restaurants and small businesses, which is, of course, something that we all care very deeply about, with the physical health of the people who work at them, which is also something we all care very deeply about?
Everything you raise is what we've taken into consideration to make sure we get this right. Again, we've never managed a pandemic before, a shutting down of an entire economy and a reopening. So we have been doing it in a smart way. But I will tell you, I've been all over the state of New York. Restaurants have been open at 50% capacity in upstate communities. I have been in these restaurants, and you wouldn't believe the lengths that these restaurant owners are going to make sure that their patrons are safe. The staff, they wear their masks the entire time. That protects them as well. The masks only come off when you're at the table. If you get up, it immediately goes on. And if you're in a diner, every other booth is closed. You cannot stand near a bar. There's no eating or drinking at a bar. You have to be sitting down. And there's limitations on how many people can be in there in the first place. So we are managing this the best we can. And for New York City's purposes, we've had this experiment. The restaurants have been open upstate. We're watching it closely, and we are ready to leap on it if we do start to see an inspection rate that starts going up. But I've been into many restaurants. They take my temperature when I walk in the door, and we figured it out. But if people are not comfortable with this, we encourage them to continue doing takeout because we want to keep these restaurants alive. This is a life or death struggle for them right now, and we want to make sure that they continue to survive through these really tough times.
Right. All right. And we know states are facing tough times, huge budget crises because of the pandemic. New Jersey Governor Phil Murphy is instituting a 2% tax increase on residents making over $1 million to help make up his state's deficit. Governor Cuomo has absolutely refused to raise taxes on the state's wealthiest. Progressives are demanding that he change his outlook on that, and you do have a Democratic majority in the state Senate and Assembly. Why not raise taxes on the uber wealthy to close the budget gap?
Well, two ways to look at this. One is that Washington, D.C. has a federal responsibility to get us through what is a national disaster. This is not a New York State problem alone. So we are going to continue to insist that they do what they're elected to do, and that is to protect this country during a pandemic and to help states like New York and all the others that have incurred extraordinary costs as well as a dramatic loss in revenues to get us through this. But in terms of the tax rate on millionaires and billionaires, if you look at the city of New York, where the vast majority of those individuals live, they actually pay higher taxes than even the proposed increase in New Jersey. So the combined state and city taxes is well over 12%, which is what they're proposing in New Jersey. So I think comparing us with New Jersey, we're actually we collect more in taxes percentage-wise than they do in New Jersey, or even what they're proposing to do.
All right, well, thank you for clarifying that for us. And New York Lieutenant Governor Kathy Hochul, thank you so much for joining us. We really appreciate your time.
Thank you very much.